Are you looking for a more advanced long-term bed for home care? Well, this is a bed that's an option, and nowadays we have it available as a refurbished bed. And this is the Hill-Rom CareAssist ES Med-Surg bed, and you may have seen something like this in a hospital. Most patients that come into me asking about getting in the same bed they were, either their loved one or themselves, when they're in the hospital. So this is typically for someone who has some sort of an extended care need, and they have certain positioning they have to be in the bed, or they just love the comfort and the way this bed worked for them at the hospital. Now they want it at home. In this video, we're going to go over the features and benefits and how this bed may work well for you and how to get it in your home. Just a few things to talk about on the bed itself. It has a 500-pound weight capacity, so that means that basically between the mattress, any equipment you have to have on the bed, total weight, including the patient, has a maximum weight of 500 pounds. There's a lot of different adjustments and a lot of different options to go with this bed as far as the way you use the controls. Basically, it has an outside controller on the outside of the rails that allow you to help control the bed in what's called Trendelenburg and reverse Trendelenburg, which is basically a fancy word for either head down or foot up. So it's either the patient's tilting backwards or tilting forward. In a hospital, we may use the bed tilting backwards for some advantages. In the home, though, you really want to make sure you're using the head up anytime you do tilt the bed back. Let's take a look at a few of the other features of how this bed works. I've taken the mattress off. So you can see this is a very supportive, firm decking you have here, which makes it great for a lot of type of air mattresses. A lot of mattresses, you don't have that spring effect you get on some beds. So it's very firm. Hill-Rom for years has really been proud of the fact that how solid this top is. It also has multiple tie down points. So if you are using a low air loss mattress, there's a lot of points so you can basically tie it down and secure it to this bed. This bed right now is in the lowest position you can get into, which is about 15 3/4 inches. So if you have an air mattress on this and someone is on the shorter side, you may just be realistic. If they're getting themselves out of bed and standing up, this might be a little bit too tall at this point. So just be realistic on that. Most patients that have an air mattress usually are getting up with a lift, something like that makes it a little bit easier to move them. But just that's the one thing, it doesn't go any lower than this. At this height, the highest point of the bed to the ground is 32 inches, which is a great height, especially when you add the mattress on there, for someone who's taking care of a patient, and especially if you're having to roll the patient a lot, using bed baths. So this is designed especially for nurses in the hospital that have to work on patients a lot, so that way the caregiver is not having to bend over. So as I mentioned, this bed is very easy to adjust. We have the ability to control both from inside the bed and the outside of the bed through the pendant. So the nurse has controls on the outside, on both sides. So I can control the knee function and the head. One thing that's very unique to Hill-Rom beds is that when the head of the bed sits up, you have what's called slide technology. There's actually a rolling point that brings this bed back and extends out the seating section, so it minimizes additional pressure on the coccyx or the lower part of the back or the buttocks. So that's a unique feature that's specific to Hill-Rom beds. Another unique feature to the CareAssist is the ability to raise and lower the foot section of the bed and elevate it up by a powered switch. Most beds that do allow this feature usually have to manually lift it up. So what's nice is I can control this by a simple touch of the button. So in addition to the knee raising up, I'm able to actually raise up the foot. This is great, especially if your doctor tells you have to elevate your feet. So you get into kind of a tilted position with the bed, where if you bring it in a little bit of reverse Trendelenburg, bring the bed down, bring the feet up, or bring the knees up, puts you in almost like a zero gravity kind of position where it minimizes pressure points throughout the body, and it raises your feet up. So if you do have that swelling, it allows you to help get some of that swelling decreased and take some of the pressure off your feet as well. So again, a lot of unique features for someone that's in the hospital, but even more features allow you to take advantage of this in the home as well. The Hill-Rom CareAssist bed comes featured with 4 rails that are already attached. So you can see this is the lower half and the upper rails. What's nice is the way they work together. If you notice, they're curved to kind of work together as a unit. What that does, it minimizes any pinch points or what's called potential entrapment, where someone could possibly get like an arm or a leg stuck between here. So if you see it, very minimal gap between here as far as getting something, part of the body, or what they call entrapment risk between here. So they really designed this well, so no matter what position either the foot section is in or the head section, it keeps a consistent gap here between the rails. And that's a very important feature when you have someone who's under chronic care and in the bed all the time. This bed also features easy to use braking system, either with a steer controlled release at the head individually by the wheel, or you have a great easy to use release at the foot. Allows you to disengage the brake system at one time, and then with one push back down of the wide lever, re-engages the brakes. So a few things that make this bed really unique is, one is the ability to put it in what's called a dining chair position. By going in that reverse Trendelenburg, raising the head up, bringing the feet down, you press the dining chair button and it brings the feet down even lower. So you're almost able to sit up at a full 90 degrees, which makes it great for sitting up, watching TV, eating, and any movement around for somebody that's in bed, especially for any length of time. It's really good for that movement, get some pressure changes on the skin, make breathing better. So all those things help enhance healing and comfort for patients. So especially if it's like a painful area, you can almost get that perfect positioning. If I want to raise the head up, tilt the bed back a little bit, raise the legs up. Now I'm able to have, because of swelling, I'm able to raise my legs up and help improve that. So if your doctor says you need to raise your feet, this bed will do that as well. So one of the big advantages of this bed is you can actually extend it from an 80 to an 84 without tools, simply by removing one lever at the foot of the bed, and you can extend it out and utilize a longer mattress for someone that's taller. The weight capacity on this bed is 500 pounds, but that includes all the stuff you see on here. So if you have to use a low air loss mattress pump, you have a mattress, so you have to include that and all the total working weight. This bed features a battery backup, so in the event of power failure, it still allows you to control all the systems of this bed, the head, the height, the foot elevation, all the same availability power things you can control the bed with are still available in the event of a power failure and you're on battery backup, and that should last you most of the day. If you have any questions about the CareAssist ES bed and how we can get it to your home, give us a call. Our product navigators are standing by and ready to help you, or just continue to browse our website here at medmart.com.